Hello, good afternoon, my viewers. I remain my humble self, pharmacist Donald. Welcome to Pharma Info. In my last video, as a continuation of that video, I discussed about a lady who wanted antibiotics, one capsule of Ampiclox for flushing of sperm after unprotected sex, which I talked about taking emergency contraceptive instead of taking the antibiotics, which is an abuse to antibiotics. As pharmacists, we are strongly against the abuse of medications. Of course, that is the main reason you should seek for medical advice. Seek for advice on every medication that you intend to take, and don't self-medicate. Don't practice self-medication. It's not fair. It's not fine. So, for the knowledge of your medication, you meet a professional, which are pharmacists. Okay, so I was talking about that lady, and I made mention of taking emergency contraceptives. Have it in the back of your mind that emergency contraceptive, it is not good to be taken more than once in a month. Then also know that there are different types of contraceptives actually. There's a one that is taken daily, daily, daily for a purpose. So, and there's a one that is taken once in a month, which if you take it more than once in a month, the side effects might be negative to you, which you don't even know. I know that some ladies don't even take into consideration of the side effects of some contraceptives. Some of them end up taking 3 times in a week. Some of them takes in a month they might take up to 7 times, which the side effect is even more negative to your health. So please, after unprotected sex, what you should do is to take emergency contraceptive if you are not ready for pregnancy. And if you don't want to find yourself in that corner of shaking to avoid pregnancy, make use of protection like condoms. Do you understand? So now let's go deeply into the antibiotic aspect of it. The effects of what you are doing is that your body, you will have a buildup of resistance antibiotics resistance. Your body will be resistant to almost all the antibiotics, so that at the time you are in need of these antibiotics to use for maybe to treat infections, or maybe to treat if you happen to have a wound, happen to have an accident, and you need to use antibiotics to treat the wound. So when they carry out a wound MCS, your body will be resistant to these antibiotics because you have been abusing them over time. Okay, anytime you are in need of antibiotics, you take a complete dose at a time. Understand? And you take the antibiotics when your body needs it. Understand? When there is need for it, not just staying and you start taking antibiotics. Understand? It is not done that way. Please, let's take note of this. Then another thing is a question I saw in my DM, because I made mention that if you have unprotected sex, the other lady said she rushed to urinate. For her mind, by urinating, she has sent out the sperm. No, the urethra and the vagina, there are two different routes, there are two different pathways which they will never meet. You get? So the urine comes out through the urethra while the sperms enter through your vagina. Understand? So there is no point where you urinate and you prevent pregnancy after having unprotected sex. The only thing that can prevent you is a UTI, urinary tract infection. Immediately after unprotected sex, try, or even after sex, try to urinate. Understand? So that helps to send out those bacteria, if there's any microorganism that passes through, because in their affair they have to be a contact to the urethra, because the urethra is just close to the vagina. Do you get? So those bacteria that was trying to find its way in, the urine will send it out. Urine is acidic, so it's going to send it out. You get? So urinating after sex does not prevent you from having or getting pregnant. Do you understand? So let's us not have that notion that mindset that after urinating, after sex, you don't have you will not get pregnant, because the sperm enters through your vagina. So I believe we will now know what to do, and take corrections on those negative practices that we always find ourselves doing. So thank you very much for watching. If you find value in this video, endeavor to like this video, share this video, and put it in your favorite so that you can always come back and refer to it. See you in our next video.